When we talk about fitness, there is a powerful misconception that the same routines, volumes, and intensities that worked at 19 will serve just as well at 30, 40, or beyond. The reality is quieter and more nuanced. The body is not a static machine. It is constantly adapting, and as we age, both metabolism and structure shift in ways that require a different approach. Understanding those shifts is not about accepting decline, it is about training smarter, protecting longevity, and getting more out of every session. In our late teens and early 20s, hormones are at a peak. Testosterone and growth hormone are higher, recovery systems are robust, and connective tissues tolerate repeated stress with less complaint. Metabolism is flexible, calories and rest can be scuffled with, and still return you to full steam quickly. Fast forward a decade, and the picture changes subtly but meaningfully. Basal metabolic rate drops, muscle protein synthesis becomes less efficient, inflammation lingers longer after hard sessions. Tendons and cartilage lose some of their youthful elasticity and vascularity. Those changes mean that doing the exact same training protocol you used at 19 can create accumulated micro damage, failed recoveries, and eventually burnout. This is why warm-ups matter more as you age. A warm-up is not merely a checkbox to start sweating. It primes the nervous system, increases synovial fluid in joints, raises tissue temperature, and gradually introduces load to structures that are not as forgiving as they once were. Start with 5 to 10 minutes of dynamic movement, tailored to the workout, controlled limb swings, hip hinges, and thoracic mobility for lifting days, brisk walking or cycling for metabolic sessions. Progressively add activation drills, glute bridges, banded pull-aparts, light single-leg work and finish with movement-specific ramps. Perform the lift at 50–70% of working weight for a few reps. A methodical warm-up reduces peak stress and allows you to perform with higher quality, not just higher heart rate. Joint care deserves daily attention. Cartilage is avascular and relies on movement for nutrient exchange. Moderate controlled motion is therapeutic in a way heavy, repetitive pounding is not. Prioritize exercises that develop balanced strength around joints rather than chasing isolated load that overloads a single structure. Include rotator cuff conditioning, scapular stability, and controlled knee-dominant and hip-dominant patterns. Supplement movement with targeted mobility work and sensible soft tissue management. Foam rolling, gentle stretching, and, when warranted, professional interventions like physical therapy. Hydration, adequate protein intake, and anti-inflammatory strategies. Sleep, omega-3s, and mindful carbohydrate timing. Also support joint health and recovery. Tracking recovery is no indulgence. It is an evidence-based way to avoid the slow slide into overtraining. Use simple, consistent markers, sleep quality, resting heart rate, morning readiness scores, and subjective muscle soreness. Track training performance. Are your lifts maintaining or improving? If not, a trend of declining numbers coupled with poor sleep and lingering soreness suggests you are overreaching. Periodize. Plan hard weeks followed by easier deloads, and respect rest days as intentional components of progress. Tools like heart rate variability can add precision, but disciplined self-observation is often enough. Finally, prioritize quality over raw volume. In youth, volume and frequency can mask technical flaws. In later years, technique becomes your armor. A well-executed set with full range of motion, clean movement patterns, and appropriate intensity builds strength and resilience more safely than grindy, high-rep work that compromises form. Emphasize tempo, control, and deliberate breathing. When fatigue accumulates, reduce volume before intensity. Fewer high-quality reps will transfer better to long-term performance than many careless ones. Aging does not mean training less. It means training differently. Metabolic shifts, tissue changes, and altered recovery capacities demand smarter warm-ups, proactive joint care, diligent recovery tracking, and an unwavering commitment to quality. Adapt your approach and you will not just preserve performance, you will extend it.